Hello and welcome to the Health, Occupations, and Long-Term Care Subcommittee. We are meeting on an unusual day because it is the last week of session and we've got some stuff we need to get done. We have 5 bills on our agenda today. We are going to start first with House Bill 975, which is the Loan Assistance Repayment Program. Then we're going to take up the 3 sunset bills. And then what time we have left, we can discuss Senate Bill 209. I'm sorry. Just kidding. Senate Bill 77, which is Senator West's bill. I know there's been some work on an amendment over the weekend, but I'm not sure all the stakeholders are in agreement yet on that bill. So we want to do the other bills first so that we know we're getting past what we need to get past in a timely manner. With that, we're going to take up 975 first, which is Maryland Loan Assistance Repayment for Nurses and Nursing Workers, Program Establishment and Funding, which is Delegate Charles's bill, which the subcommittee probably remembers we discussed earlier in session. I'm going to go with Lindsay on this bill. Yes. Yep. Thank you, Lindsay. And Lindsay will remind us what the bill does, and I will make sure everybody knows we've been working with stakeholders on some minor amendments to this bill. Go ahead, Lindsay.
This bill establishes a Maryland Loan Assistance Repayment Program for nurses and nursing workers and an associated special fund for the program under the Department of Health. I circulated amendments, which are actually drafted to the cross-file Senate Bill 696 on this bill. The reason for that is that the Senate already had started amending this bill a little bit. And what they did is they took out references to nurses that are working in primary care. That was a limitation that I guess the Senate did not feel was particularly useful, especially when you're trying to expand the nursing workforce, and primary care is a very limited area. That language was because this bill in general was modeled after the Physicians Loan Assistance Repayment Program, which is trying to get physicians who are working in primary care. And some of the other changes from these amendments are also to remove some of those limitations that are based on the way the physician statute is drafted. So I circulated a reprint. Again, it's to Senate Bill 696. The first sort of overarching change is the change in terminology from nursing worker to nursing support staff throughout the bill. And that also changes the title of the program and the fund. If you look at page 2 of the reprint, the definition of nurse includes a number of subsets, if you will, of nurses. And I added language to clarify that it includes nurses who are certified to practice as nurse midwives or clinical nurse specialists. They were already covered in the definition of advanced practice registered nurse. But because nurse anesthetists and nurse practitioners were especially called out later in the definition, it just seemed a little strange that those weren't listed specifically. It made it seem like maybe they weren't included or it was just unclear.
Did you check the other persons web banking as well?
Then on page 3 of the reprint, you'll see that the Senate amendments struck the definition of primary care because that's being struck elsewhere in the bill, that limitation. Let's see, moving to the top of page 5 of the reprint, there was language limiting the nurses in this case to those who practice in an eligible field of employment in a geographic area of the state that has been federally designated. So that limitation to geographic area was struck at the top of page 5. And then further down, this entire section of 241805 was struck because that's the priorities for loan repayment assistance, which prioritized folks who are practicing in these geographic shortage areas. Again, this was all based on the idea of trying to get physicians into rural areas of the state where there would be physician shortages, but arguably the entire state is facing a shortage. So the idea of trying to get folks into certain geographic areas perhaps doesn't make as much sense here. There's also language about trying to get them to practice for a certain period of time in those areas, which also didn't necessarily apply. But further on in the bill, there's a work group being created both to come up with ways to get folks into practicing nursing, trying to work on a permanent funding structure for this loan repayment program. And then also we've tasked them with making recommendations on what types of priorities might make sense for prioritizing applicants for loan assistance repayment.
So can I just put a pin in your
Yep.
description for a second? So with the amendment, we're striking the existing requirements for geographic areas because we're acknowledging that there is currently an active statewide everywhere nursing shortage. So we don't want to design it that way. But the work group would allow for recommendations for further refinement in the future. And then
Yep.
in the work group, currently in the reprint, we do not have AFSCME and leading age, but we need to add those in as well. So that'll be.
Yes, I was going to get to that.
Okay, perfect. Go ahead. Go with
Sorry,
it.
I'm going like through page by page, but yes.
No, I
absolutely.
really appreciate it. I
But
see the
the work group
stakeholders
that
here,
needs to
so
be
I
added.
want to make sure as the members are looking at the reprint, they're thinking about that as well, since those stakeholders are here. Go ahead.
So let's see, on the top of page 6, after line 5, you'll see that the department should be adopting regulations, including with advice from the stakeholder work group, priorities for funding the repayment of education loans through the program. So that could end up being some sort of geographic priority. It could be practice area priorities. It could be, practice in certain types of facilities. It could be any type of, thing, whatever the work group comes up with that I can't think of. So let's see, page 7, this language is struck. This would have been ongoing funding for the program from the Board of Nursing. That was a big concern that was brought up the last time the subcommittee took up this bill. So as Delegate Kelly mentioned, there's $2 million in the budget now that's the budget language is transferring from NHEC to MDH for the purposes of this program, and it's contingent on these bills passing. So if for some reason these bills don't make it, then the money just stays with MHEC. But if that money is transferred, this is a special fund, so they can spend it all in 1 year, or if they don't spend it all in 1 year, it will stay in the special fund. Speaking of which, I noticed not reflected in these amendments, I need to put in a little technical change just to reflect that the interest from the fund should go back into the fund. That's a very minor thing. But so that $2 million will last however long it lasts. And then this bill is silent on ongoing funding. The work group is supposed to be coming back with recommendations for ongoing funding, but the language specifically having the Board of Nursing putting in $400,000 each year, that's struck.
And I would imagine, I see Rhonda's here. That's very important to the Board of Nursing, I would imagine. Yeah, okay. Okay, good. Okay, did we walk through the whole thing?
So then the last thing is on pages 9 to 10 is the language on the work group. On page 10, I mentioned they're tasked with making recommendations to MDH on priorities for funding. And then on page 9 is the representatives in the work group. And when this subcommittee met previously on this bill, they added this work group language to a different bill, House Bill 1208, and at that time added Leading Age Maryland to the work group, and I just forgot to add them here. And then AFSCME has also requested to be added to this work group. So I can make those changes along with the little technical change that I mentioned about interest from the fund.
So I'm going to ask the subcommittee to consider these amendments with those 3 changes that are not written down, but assume that we're adding those in, adding in AFSCME, adding in leading age, and adding in the technical change about the interest from the fund. With that, I already see some questions. So go ahead, Delegate Krebs. We have some stakeholders here who can answer questions as well,
Thank
but let's
you.
hear from Delegate Krebs.
I noticed that on page 8, one of the things that was struck is about serving at least 2 years in a geographic area of the state that has been designated by the secretary as being medically underserved. How is that going to be addressed with the new group? Specifically for medically underserved, not just geographically, but a medically underserved area.
That would be up to the work group to come up with if that's one of the priorities for repayment. So essentially, if you have 100 people applying for loan repayment assistance, there has to be some methodology of, it could be first come, first served. That could be the method of priority, but the work group can come up with some other prioritization of loan of.
And I just think that
they're more in need than someone else. And so it could.
I don't disagree, but I also think that we need to give direction. And I think making sure that the medically underserved areas, don't know what they are the priority, not just first come, first serve. I mean, we're leaving it up to the work group and let's hope that that's what they would just determine, but that's what we've had in the past. So I think we need to make our intentions known of where.
Well, the work group doesn't necessarily trigger any policy change, right, Lindsay? The work group's making recommendations to us, and then we will.
They make recommendations to the department, and the way the language is now, the department it establishes in regulation what the priorities would be.
Okay.
The department being Department of Health. So they're running the program and they would come up with priorities by regulation. We can change that. But that's the way the amendments are drafted right now.
Is there anything in current law that talks about serving in medically underserved areas first, priorities?
That is the way the physician's loan repayment program is structured.
I would just hope that would be the way the nurses program would be structured because it's important. There's some areas don't have certain kinds of nurses at all in some of the rural areas, and then maybe some urban areas. I don't know, but I just think that should be a priority. Thank you.
Well, I'm going to call on Robin Elliott if I can and ask her, how do you envision sort of the work group moving forward and setting priorities for shortage areas? Since I think that the work group component came largely from the nurses. Go ahead, Robin.
Yes. Good morning. So thank you so much. The Maryland Nurses Association really appreciates this legislation, and with the amendments, we think that there is a very functional and flexible program. And Delegate Krebs, to your question, I think the way that this is designed will allow the Department of Health to work with stakeholders and change the program as the dynamics of the nursing shortage changes. So right now there's probably a shortage everywhere. But in 2 or 3 years, as hopefully it lets up, they can readjust and look at really what are the priority areas. They can also decide to do exactly as you framed, which is focus on certain underserved areas right from the start. So I think we thought it was just a little challenging to figure out what areas of the state were underserved in this nursing environment.
So I think that the idea is that the language from the physicians program, which was specifically designed in a different world with a different problem, isn't going to work in this instance, right? Okay.
That's the way we saw it. Yeah.
It looks like Sarah Peters has something to add.
Good morning. Yeah, here on behalf of the Nurse Practitioner Association of Maryland, and just also want to request that they have a seat at the table with the stakeholder group.
And so that means we would need to add to our laundry list here. So we have Secretary of Health, State Board of Nursing, Nurses Association. We would add Nurse Practitioners Association of Maryland, along with HBAM SEIU, Hospital Association Lifespan. I think that sounds reasonable. I'm looking for nods from the committee. Is the committee amenable to that request? Yes, I see a lot of nods. Okay. Rhonda, did you have your hand up and then down again? Do you need to add something?
Yes, good morning. Thank you. I just wanted to say for the board really appreciates the removal of the language that strikes the $400,000 comment coming from the Board of Nursing Fund, but there was just one small other area that we wanted to point out that was a little concerning. It's on page 4, line 28, 29, where it talks about the department assisting with the repayment of the funds that's using the funds transferred to the department by the comptroller under 8-206. So that's the Board of Nursing Fund. So the money that we send to the comptroller is going to go back to the department. So in essence, we're thinking that still would have the Board of Nursing on the hook for filling in the gap between whatever's not covered of the $400,000. I'm not sure if that's the case, but that was an area of concern that was still brought up.
Yep, I can take out that cross-reference.
Excellent.
Okay.
Good,
All right.
good
Thank
catch.
you.
So we will strike that. That makes sense. Good catch, Rhonda. Thank you. Do we have any more questions from the committee? Len, do you have anything you want to add since this was originally your bill? I know we've got some amendments on it.
No, thank you. 1199 SEIU supports all these amendments, and thanks to the subcommittee for your work on the bill. It's a very important bill. There are nursing shortages every place in the state right now, and so it's really neat, a very important bill to pass.
Excellent. So I don't see any more questions. We've got probably 10 minutes, maybe 15 left of the subcommittee. So if someone wants to move these amendments, that'd be awesome.
The amendments. Second.
Moved and seconded. Any further discussion of the amendments? All in favor of the amendments say aye. Aye. Anyone who's opposed, raise your hand in the chat. Looks like they're passing unanimously on the bill as amended.
Move the bill as amended.
Moved and seconded. Any further discussion on the bill as amended?
And I'll just clarify real quick. This is two bills, House Bill 975 and Senate Bill 696. We'll make it identical.
Perfect. Thank you very much for that clarification. I was forgetting that. All in favor say aye. Anyone who's opposed, raise your hand in the chat. Looks like it passes unanimously with all of those amendments, including the NPAM amendment, the technical change, AFSCME and leading age added to what is written, as well as the cross-reference removal. Writing that down so we don't forget. Perfect. Thank you so much. Let's move on to the sunset bills. So we have three sunset bills: the psychologists, the optometrists, and the physical therapy examiners. Are they? I don't know who has those, Lisa or Lindsay? Lisa has all of them?
Yes, I do.
And it's all the exact same amendment we're doing on them?
For the most part, I mean,
Why don't you run us through what we need to know?
all of the bills as originally drafted extended the boards for 10 years, which is typical for termination provision sunsets to be extended for 10 years. In the Senate, they reduced all of them by 2 years. There were amendments distributed.
They reduced all of them from 10 years to 2 years. Okay.
To 2 years, yep. And then there is an amendments that have been distributed that would change it back to the 10 years. One of the boards, I can't remember now which one. Would sunset this year as opposed to, I think so. The dates are off on just one of the boards in that extending it 10 years makes it 2032 instead of 2033.
But we can basically have the same policy discussion about the decision to, okay.
Yes. Mm-hmm.
So I think as the committee is familiar, we heard these just last week. The Senate took the 10-year period and made it a 2-year period. There were no deficiencies or anything found that would justify that, is the testimony that we heard. I want to make sure the subcommittee is aware that we have, a process in place that is a relatively new process that allows members to request sort of what we used to have in terms of a sunset review, detailed review that is maybe more targeted in specific areas at any time. So we no longer have to wait for that every 10 years to get that support from DLS and investigating challenges with the board. So I don't think that the Senate position on this is actually going to get at what their goal appears to be. I think that they maybe had some specific concerns that they need to work out, either with the board specifically or through asking DLS to investigate and do some sort of report at some point. But tying that to the official sunset is not going to accomplish their goal. So I'm going to recommend to the subcommittee that we support the boards in their request that we go back to the original 10-year timeframe. I think that's going to make a lot more sense. And I think whatever problems they were trying to address, this was sort of like a sledgehammer that, that could actually maybe be addressed with a thumbtack. Delegate Bagnall, do you have a question or a comment?
Just a process question, because we're discussing these bills together. Are we able to move the amendments together, even though they're slightly different, but they're the same policy?
That's a question for Lisa. What do you think? We can do them all one in a row, or, subcommittee is just a recommendation to the full committee. So I think we probably can. That would be my guess. Yeah, it's the same policy decision.
We'll vote on them separately in full committee, but for the purposes here, as long as everyone understands what's going on, I think we're okay.
And I do see Lorraine Smith. Oh, I'm sorry.
I was just going to say, can I move the amendments for discussion?
Absolutely. Second. Moved and seconded. So on the amendments, did Lorraine go ahead. I see you. Do you have something to add?
Hi, thank you for allowing me this opportunity. I apologize. Last week I had technical difficulties. I could hear you, but you could not hear me. Of course, the board supports moving the amendment to extend the board into 2033. And as stated, we do not have any deficiencies. The Board of Psychology does not have any deficiencies. And we're continuing to work with the Department of Audit to just stay on top of things. So thank you for this.
Excellent. And I do see Lori Kendall Ellis here also. Do you have anything to add?
No, I think Lorraine said it eloquently. We've been working to review everything and tying this to the extension. As I stated, it is confusing because it can be reviewed at any time versus closing a board down. So thank you.
Excellent. Sorry, I think that's it. Okay, so Delegate Krebs.
I just want to verify, and we said this before the meeting, but that financial audits are still being done periodically, because that's important, not to just wait every 10 years or as requested, but that the financial pieces are still happening. It's just not the full audits.
The Office of Legislative Audits conducts a fiscal compliance audit about every 3 to 4 years.
Just wanted that to be on the record. Thank you.
Excellent. Thank you for that, Delegate Krebs. So the amendments have been moved and seconded. All in favor say aye. Aye. Anyone who's opposed, raise your hand in the chat. Looks like it is unanimous. And now we're going to take a vote on all three bills. So that's Senate Bill 195, 202, and 209.
Move the bills as amended.
Moved and seconded. Perfect. Any further discussion? All in favor say aye. Aye. Anyone who's opposed, raise your hand in the chat. Okay, passes unanimously. Thank you all very much for being here. I really appreciate it. We have a couple minutes left before bells ring to discuss Senator West's bill, which we started on last week, which is Senate Bill 77. I can tell the committee, I know that Senator West was working diligently on an amendment. It doesn't appear that all the stakeholders are on board with that amendment yet. Delegate Carr, did you have a question?
Yes, Madam Chair, and I apologize for this. I tried to raise my hand during the discussion of the first bill, but for some reason it wasn't working. But I guess just to clarify,
the nursing bill.
The first bill we took up. So it looks like the reprint is not what we voted on. There were some additional amendments that came in over the weekend that weren't in the hearing testimony, such as adding additional stakeholders. I was not really clear on that when I voted for the bill. So, I might bring that up when we bring it up for the full committee to discuss, because I'm just not completely clear on, everything we voted on since it was not in the reprint.
Well, let's take the time now in subcommittee, because I certainly don't want chaos in the full committee. So while we have everybody here, what's your specific concern? You just want us to walk through again what was in those?
Yeah, looks like there was a company called Leading Age that is added to the list of stakeholders.
Yeah, so Leading Age, we actually had the policy discussion to add Leading Age back when in 1208, we adopted the same work group language, and we all voted and agreed to add Leading Age in at that point. They deal with long-term care in multiple different spaces. So it's very important that they're part of that conversation for nursing. We also added in AFSCME and NPAM, the nurse practitioners.
Okay, but like Leading Age, that was not in their hearing testimony. So that was something that came in late, like over the weekend.
Leading Age, actually, I think Aaron's here from Leading Age. I'll let him speak to this, but we did have this conversation when we first moved this work group language out of this bill into 1208. But then
what bill was that in?
Accidentally dropped it. So House Bill 1208 was the other nursing bill that we did. So originally, when we didn't think we were going to be able to move this bill, we moved 1208 and we took the work group and put it in 1208 out of this bill. Now that this bill is moving, we want the work group back in this bill, which is a more appropriate place for it. So with that in mind, we took the same conversation about Leading Age having a seat at the table and added that to this amendment. I think Lindsay's intention was to put that in the reprint, but it kind of got dropped. Lindsay, do you want to speak to that?
Yes. So as Delegate Kelly just mentioned, in House Bill 1208, we moved this work group with essentially the same tasks, except looking at a potential nurse loan repayment program, and rather than a one that was being created in a bill, and put it into House Bill 1208, looking at a program for the future. But this language was already there. And then when we added that language to 1208, we added Leading Age at that point. AFSCME and the Nurse Practitioner Association, the Nurse Practitioner Association just raised it during this meeting. AFSCME raised it via email to Delegate Kelly over the weekend, being added to this work group. And then also, I guess I just wanted to note that the amendment language also allows any other stakeholder that the department determines appropriate. So this isn't necessarily an exhaustive list of who would be in the work group. It's just illustrative of who should be represented at the table.
And I would add that Leading Age represents the nonprofit long-term care facilities. And, these are a voice that I really, really want to have at the table. I think it's incredibly important from a policy lens. So the voice they're bringing to the conversation in terms of nursing loan repayment, it was an oversight to not have them in there from the beginning.
Okay, I still have some questions, but I'll take it offline.
Okay, thank you. So let's go back. I'm sorry, Senator West, for the delay. So as I was saying, Senator West has been working over the weekend on an amendment. I don't think all of the stakeholders are there yet, but why don't you give us an update, Senator West? And I appreciate you being here today.
Sure, and I appreciate being invited to attend. It's nice to see Lindsay and Lisa in particular. I haven't seen you all in about 2 years. The word I got from last week was that there was a concern about the bill in two respects. I guess just one respect, and that is that that with respect to inspections of licensees, so someone at the dental inspectors board comes to a dentist's office and wants to take a look at what's going on and the condition of the equipment. And the argument was that the dentist might be able to say, you can't do anything until my attorney arrives, and stop things in its tracks until the attorney showed up, maybe hours, maybe days later. So in order to deal with that, my aide, Alex Harlan, worked with Matt Dudzik over, I think it was Friday, to come up with an amendment. And they did that. The new amendment says a spontaneous or unannounced inspection of a licensee place of work shall not be considered an investigation for purposes of this section. The bill had provided that when there's an interview in connection with an investigation, the licensee would be permitted to have an attorney present to represent his or her interests. So what this established is that a surprise inspection was not an interview, and therefore there would be no right on the part of the doctor to delay things in order to get an attorney present. While they were talking, Alex and Matt also agreed to take out the word participation in and substitute advise the licensee to further delimit what the attorney could do in the context of an interview. So my understanding was that I think the two of them sort of concluded the conversation with that's it, that's great, everything's set to go. But then on Sunday, yesterday, I received a letter dated today from the Board of Dental Examiners, which basically said that in their view, lawyers would engage in filibusters and would thoroughly disrupt proceedings, and then there would be no way to exclude them from proceedings because you couldn't prove that they'd been disruptive. For that reason, the board was against the entire bill from soup to nuts. So I'm not sure what happened in between Friday and Sunday, but obviously something did. And so the Board of Dental Examiners is totally off the reservation at this point.
Well, I think, if I may, and part of this may have been my fault because I asked you to work with Matt Dudzik, who expressed a lot of the concerns, but the dental board also had concerns. I believe the nursing board is here today also with concerns. Yes. So let's hear from them because hopefully we can, it sounds like there's some there with this bill, but it's not quite there yet. And maybe we need to work collaboratively with more than just the Board of Physicians to figure out how to make an amendment happen. So let's hear first from Matt because he had his hand up, and then we'll hear from Edwin and Rhonda. Go ahead, Matt.
Good morning. And first of all, I want to thank Senator West and his office for reaching out because I really do appreciate it. And I think the amendments definitely get in the right direction. I do want to point out that the Board of Physicians still has a couple of remaining concerns. And I expressed these to Alex when I spoke with him on Friday. The first is very technical. I don't think it's a huge barrier, but the place of work definition isn't quite the definition that we use in statute. It's under 14-206D is the entry onto premises. We use the term a place of business of a licensed physician or public premises in terms of unannounced inspections. So just want to make sure that language aligns. That's a fairly minor change that hopefully will not be controversial. I do, let
me put a pin in it because evidently the bells are ringing. Thank you, Delegate Lewis. I can't hear them in my office, but It sounds like there's still some minor concerns or possibly major concerns. I'm going to send Senator West back to the drawing board because at least we've got these 3 boards present and we need to hear what those concerns are and see if we can get an amendment that addresses them. But we can't do it in subcommittee because we all have to be on the floor. So I apologize. Subcommittee meets again on Thursday. Thank you all for being here and all of your patience, and at least your hands up raised in public means that we know you still have concerns.